Hello everyone, today we will see the features of radius. This bone is a bone of forearm. It is situated on the lateral side and it is homologous with the tibia of the lower limb. Now for identifying the side, the upper end, this is disc shape. You can see the upper end, this is disc shape, while lower end, this is lower end, which is expanded. And it has a styloid process. This is elongated area. This is styloid process. In the lower end, this is anterior surface which is smooth and it forms a thick prominent ridge here. While you go on the posterior side, it has tubercles which are present on posterior side, the four grooves which are seen here. The border which is sharpest, easy to identify, this border. This is medial border or interosseous border. And on the lower end, on the posterior side, this tubercle which is prominent here, it is called as dorsal tubercle of Lister. Another thing you have to remember here for the styloid process, because the radius it is on the lateral side of the forearm, so styloid process will be on the same side. It is on the lateral side. And for interosseous border, this is prominent border. It will be always on the opposite side. So on the radius, it becomes a medial border. These are again the two important things we have to remember. Now when we go in the upper end first, the head, it is disc shape. This is head, you can see it is disc shape. This is head. And is covered by the hyaline cartilage. And this concave surface, as we have discussed in humerus, right, it articulates with the capitulum of the humerus at the elbow joint. While the circumference, this margin here, the circumference of the head is also articular and it fixes a socket. It is formed by the radial notch. The radial notch is present in the ulna and it forms here superior radio-ulnar joint. Okay. Now next with the rake, the constricted part below the head, this is this neck. The area below the head which is known as the neck of the radius, it is enclosed by annular ligament which is covering the neck of the radius. And head and neck, they both are free from the capsular attachment, so they can rotate freely within the socket. The part below the neck, this is known as the tuberosity of the radius, which is lying below the medial part of the neck. We can see it has two surfaces. This is smooth and this is rough. So rough will be posteriorly, smooth will be anteriorly. So this radius, it is left-sided radius. Now in the shaft, it has three borders and three surfaces. The anterior border extends from anterior margin. You have to go with the lower border of this radial tuberosity, continue down near the styloid process. This is anterior border. And upper part, this is oblique. You can see the oblicity. This is called as anterior oblique line that is present along the same anterior border. While the lower part, it is sharp and it is crest-like here. This is anterior border. Mirror image, go on the posterior side. It is similarly seen here. For the posterior border, it is ill-defined. It is not clearly defined, but it is again the oblique here. This is posterior border like this. Again, it's oblique in the upper part, which is called as posterior oblique line. Now the last, this is most prominent, easily seen interosseous border, that is medial border in case of the radius. So it extends again from the radial tuberosity here, going above the posterior margin. This is radial notch. So this border is going from the tuberosity, it reaches till here. This is interosseous border or the medial border. Now what are the three surfaces here? We have to identify anterior border, we have to identify interosseous border or a medial border. So area between the anterior and the medial, this part, It is anterior surface in case of the radius. To identify the posterior surface, we have to find out this interosseous border, find out the posterior border. So area between two this, one medial, one posterior border. This is about the posterior surface. To find out the lateral surface, you have to find out first anterior border, go with the posterior border, this area, along with the same, this is styloid process. So, between the anterior border and posterior border, this part, it is called as lateral surface. Now, after the shaft, we see the lower end. The lower end, it's the widest part of the bone. It has 5 surfaces. This is anterior surface, first here. It forms a prominent ridge and we can palpate the radial artery along the same surface. This is posterior surface. It has a grooves and the prominent one tubercle, as we have discussed, dorsal tubercle of Lister. Now the medial surface. It has the presence of ulnar notch here. Opposite side. This is styloid process. On the lateral surface, we can see the presence of styloid process. If I go on the lower side, this is inferior surface. It has the impression of 2 bones. One triangular area that is for scaphoid bone laterally and another area that is for quadrangular area for lunate bone. So scaphoid and lunate, it is on the inferior surface. We can see the area for 2 carpal bones. Thank you. Hello everyone. Today we will discuss the attachments and clinical anatomy of the radius. So first we go on the radial tuberosity. This is radial tuberosity. It receives the insertion of bicep brachii on this posterior, that is rough area. Now we go on the lateral surface. There are 3 muscles which are inserted here. On the upper side, it receives the insertion of supinator. On the middle side, it is pronator teres, and on the lower side, it is brachioradialis. So it receives the insertion of 3 muscles on the same lateral surface. Now, the radial head of flexure digitorum superficialis. It takes origin from this anterior oblique line, which is continuous with the anterior border. It is nothing but the upper part of anterior border. So this is the area for origin of flexure digitorum superficialis. Now we go on the anterior surface here, upper 2/3 area. This is anterior surface. It has the origin of flexure pollicis longus from this upper 2/3 area. Going on the same anterior surface, now on the lower side, the muscle, it is pronator quadratus, which is inserted here along the same anterior surface, lower part. The origin of pronator quadratus, it is going with the ulna in the same lower part, lower end. Now, this is the area where we can feel the pulsation of radial artery. Okay. Now going on the back, that is posterior surface here. What are the muscles present here? On the posterior surface, you can see abductor pollicis longus, next extensor pollicis brevis. They take origin from posterior surface. On the medial side of the neck, this is medial side. It gives attachment to the quadrate ligament. And on the medial side, just below the radial tuberosity, it has the attachment of oblique cord which is attached here. Okay. Now articular disc, it is going off the wrist joint, the anterior articular capsule for the wrist joint. It is attached on anterior and posterior margin of inferior articular surface. This is for the articular surface for giving attachment articular capsule of the wrist joint. Another area on the lower border of the ulnar notch. Find out the ulnar notch here. This is for the inferior radioulnar joint. The head of the ulna is going to articulate here and makes inferior radioulnar joint. So articular disc, it is attached here. Now, anterior border, we go on the most lower part. This is the area which gives attachment to extension retinaculum here. And along the interosseous border, this is interosseous border. It gives attachment to same interosseous membrane. Thank you. The applied anatomy of the radius. It is commonly fractured about 2 centimeters in the lower end. This is a common area which is called as Cullis fracture, and this is caused by fall on the outstretched hand. Okay, when the distal fragment is displaced upward and backward, this is radial styloid process which comes nearer proximal to ulnar styloid process. Okay, so if the distal fragment gets displaced anteriorly, term will be changed. It is called as Smith fracture. Another thing, the sudden powerful jerk on the hand of a child, it may dislodge this area, the head of the radius, okay, from the grip of annular ligament. And this condition is called as subluxation of head of radius, or also it is called as pulled elbow. Thank you.